GDM at the moment is approximately, if we look at the world, around 14% of the world population will have GDM. If we look at India specifically, that number rises quite significantly to over 20%. The true figure may be much higher than 20%. Different domains we can split problems into. First and foremost is diagnosis. There's a lot of disparity in who gets diagnosed. The second challenge is how many of these people are actually able to follow up routinely. And the final challenge comes down to what do we do in regards to adjustment of therapy. Artificial intelligence in general, context of pregnancy diabetes in particular, it's game changing. Artificial intelligence is a step beyond that, where we're also now able to directly institute treatment, diagnose, manage appropriately people that might be hundreds of kilometers away. Has got substantial scope for improving quality of care.
Welcome to the D-Genius, the D-Genuine podcast. Now today we have an international speaker and endocrinologist from Sydney, Australia, who practices as an endocrinologist, specialist in diabetes and pituitary care. Just a minute, I'm very sorry. He is a Chelsea fan, born in Ahmedabad, lives in Australia, bleed blue fan. I've traveled around 50 international countries, and I think he has just 4 brain cells. So just please forgive him if he stammers. So welcome to the podcast, sir.
Thank you for having me.
Yeah. So we'll be talking a bit about a life-changing paradigm in the management of pregnancy diabetes. How is AI used? So the first thing I would like to ask, sir, what is an overview of GDM, its global prevalence and its impact?
So GDM at the moment is approximately, if we look at the world, around 14% of the world population will have GDM. If we look at India specifically, that number rises quite significantly to over 20%. And that's factoring in that we don't even know how many people in regional areas or underprivileged areas may not even have the investigations done. So the true figure may be much higher than 20%. And so it is a very significant condition that has substantial quality of life impacts for patients, but also long-term ramifications for the children as well.
Fine, great. So what are the challenges do you find, sir, in managing GDM globally?
If we talk about it from a big picture perspective, there's different domains we can split problems into. First and foremost is diagnosis. There's a lot of disparity in who gets diagnosed, who doesn't get diagnosed, depending on resource-rich or resource-poor areas. The second challenge is once a diagnosis has been made, how many of these people are actually able to follow up routinely for healthcare services? There's no benefit in us diagnosing GDM if we never see the patient again and they have the complications of macrosomia or stillbirth or type 2 diabetes in children in future or delivery complications. All of these things are imperative for us to try and prevent from happening, but unless and until we have the services in place, not just to diagnose, but also to continue management, that's a challenge. And the final challenge comes down to what do we do in regards to adjustment of therapy? So if a patient has high glucose levels and we think they need management, then are we able to administer insulin for these people? Do they have the education to administer it appropriately? Are there any allied health services around dietitians, diabetes nurses, etc., depending on where they live, for us to be able to optimize their care?
So in a developing country like India, I think the screening will be the first and foremost thing that has to be boosted, right?
Yes.
So, sir, I know that you love technology. So, how will you say that AI will help in pregnancy diabetes management? What is your view and your any personal experience?
Yeah. So look, I think with artificial intelligence in general, it's the buzzword for the world at the moment. There's a lot of pros and cons. I think in the context of pregnancy diabetes in particular, it's game changing because what it does is it makes the world even closer. Similar to when the internet came around, the world was so distant before the internet, but now you can talk to someone across the globe, share ideas and experiences and connect. artificial intelligence is a step beyond that, where we're also now able to directly institute treatment, diagnose, manage appropriately people that might be hundreds of kilometers away who previously would have had to drive or travel to be able to get that kind of assistance. So I think that the scope for artificial intelligence in helping diabetes management, in particular with pregnancy, given how frequently we need to visit, that's going to be huge. In my personal view, I would say that clinical experience from our hospital suggests that artificial intelligence has got substantial scope for improving quality of care and also continuity of care. So we're able to automate interpretation of oral glucose tolerance test results. We're able to risk stratify based on ethnicity, based on previous history of pregnancy diabetes, previous SGA or LGA, or complications around the diabetes and the delivery. And we're able to then ensure that they're being given appropriate care at earlier intervals, whereas current standard of care, you do glucose tolerance tests at 24 to 28 weeks. And then by then, who knows what their diet was, what their lifestyle was, what they were doing. We may have already missed the boat. So giving these AI algorithms and models with machine learning an opportunity, we're able to detect earlier, we're able to intervene earlier, and we're able to improve patient care.
So just the last thing I would like to ask, is there any cons on your list of using AI in this type of case, or do you think there will be any cons in the future?
I think it's early days at the moment, so there are teething issues. One of the key things that we find is with AI, the data sets that we train models on are still very small if they're done in-house. But if they're looking at using broader scale models or data sets, the problem there is that you can't titrate care according to your local needs. So sometimes there can be biases that are inherent in the databases themselves that may output incorrect information for what we need. So I do think that the future is going more towards agentic AI, which is where we're able to have models that can directly interact as opposed to a one-way where we feed information, it spits out an answer. Instead, we feed it questions. It asks us more questions. And then by doing so, it's able to use the neural networks a lot more precisely and then titrate intervention according to subgroups of populations based on complications and risk.
I just feel one thing that with the emerging use of AI, the patient doesn't become a doctor. That's the only big cons I think of.
I mean, look, everyone's a Dr. Google expert anyway.
ChatGPT, even the patient can use it.
Yes.
So this is my diagnosis. Please prescribe me this treatment. I
Yeah.
just need a stamp and sign. So here with Dr. Ashish from Australia, we would like to sum up and thank you so much, sir, for inviting such a great information. Thank you so much.
Thank you.